Research shows there may be some evidence certain people spread COVID-19 more than others.
Medical reporter Liz Bonus shares what we know about super spreaders.
Hey guys, hello to you. This concept of super spreaders has been looked at several times since the beginning of this pandemic. This according to infection control specialists and internal medicine providers that we talked to at Ohio's TriHealth. So here's what they say we all need to know about it. The first thing to know is that the super spreader concept means most of the virus is spread by very few people. Preliminary research, not yet peer-reviewed, however, debates how that happens. For example, it could be about viral load and timing.
There are going to be some people that are shedding more virus. That's just the nature of a virus, and there's always a peak shedding period.
It could also, however, be about proximity.
So if you are in a let's say take a bar, for example, or you're in a facility where you're in close proximity and you're talking for an extended period of time close to someone, there's going to be droplet spread at a higher rate than if you were in a large room separated.
So the second thing you likely need to know is that keeping your distance is really the only way to protect against someone who might be a super spreader.
The concept of super spreader has more to do with the proximity of people that are carrying the virus to some degree.
So when you hear this concept of super spreaders, you think what? Should we really have to change anything?
The bottom line is we have to use precautions. If you think that somebody has the condition, the virus, COVID or other, you use your standard precautions. And when you evaluate them, you use the PPE that's appropriate. Unless there were a test that said, okay, this person is a super spreader, and then you would quarantine that person. But I don't see that being available in the near future. I think it's a hypothetical.
As always, if you have questions about preventing this virus, make sure that you have a conversation with your own healthcare provider. I'm medical reporter Liz Bonus. We'll throw it back to you.